Hey there, amazing people. Welcome to Donut Dental. I'm Dr. Ganesh and I'm here to help you ace the CSCE OSCE exam. Let's get started. Dental Radiography Essentials. In the realm of dentistry, dental radiography plays a pivotal role in diagnosing and treatment planning for various oral health conditions. The ability to visualize structures hidden beneath the surface allows dental professionals to identify issues like cavities, bone loss, and impacted teeth that may not be readily apparent during a clinical examination. In this video, we'll delve into the essentials of dental radiography, exploring the principles behind radiolucent and radiopaque structures, key landmarks visible on radiographs, and the interpretation of these images. Radiolucent versus radiopaque structures. Dental radiographs are essentially shadows cast by X-rays passing through different structures in the mouth. The varying densities of these structures determine how much radiation is absorbed, resulting in areas of varying darkness on the image. For radiolucent structures, these appear dark or black on the radiograph because they allow X-rays to pass through them relatively easily. Examples include air spaces, sinuses, nasal fossa, and the airway, soft tissues, muscles, fat, and nerves, pathological lesions, cysts, abscess, and tumors. Radiopaque structures, these appear white or light gray on the radiograph because they absorb more X-rays. Examples include bone. The denser the bone, the whiter it appears. Teeth, enamel, dentin, and cementum. Restorations, amalgam, gold, and some composite materials. Metallic objects, jewelry, piercings, and dental appliances. Key landmarks on dental radiographs. Dental radiographs reveal a wealth of anatomical landmarks that aid in diagnosis and treatment planning. Let's explore some of the key landmarks. Lamina dura, a thin, radiopaque line surrounding the tooth root, representing the compact bone lining the tooth socket. A healthy lamina dura appears dense and continuous, while thinning or absence can indicate periodontal disease. The median palatine suture, a radiolucent line in the midline of the palate, representing the junction between the two palatine bones. Incisive foramen, a small oval-shaped radiolucency between the maxillary central incisors, representing the opening for the nasopalatine nerve and blood vessels. Maxillary tuberosity, a rounded radiopaque prominence distal to the maxillary third molar region. Coronoid process, a triangular radiopaque projection often seen overlapping the maxillary tuberosity on panoramic radiographs. External oblique ridge, a radiopaque line running across the mandibular molar region, representing a bony ridge on the external surface of the mandible. Mandibular canal, a radiolucent band outlined by a thin radiopaque line extending from the mandibular foramen to the mental foramen. It houses the inferior alveolar nerve and blood vessels. Mental foramen, a round radiolucency below the mandibular premolar apices, representing the opening for the mental nerve and blood vessels. Zygomatic process, a U-shaped radiopaque band superior to the maxillary molar apices. Nasal spine, a radiopaque triangular shape at the median palatal suture where the nasal septum and fossae meet. Nasal septum, a thin, vertical radiopaque line dividing the nasal cavity into two. Interpretation of radiographs. Interpreting dental radiographs requires a keen eye for detail and a thorough understanding of normal anatomy and variations. By carefully analyzing the radiographic findings in conjunction with clinical examination and patient history, dental professionals can accurately diagnose and develop effective treatment plans for a wide range of oral health conditions. Conclusion. In this video, we've explored the fundamentals of dental radiography, from the principles of radiolucency and radiopacity to key landmarks and interpretation. By mastering these concepts, you'll be well equipped to understand and utilize dental radiographs as a valuable diagnostic tool. In our next video, we'll delve into common radiographic errors and anomalies, providing insights into how to avoid mistakes and recognize unusual findings on X-rays.